Can this common kitchen spice actually support blood sugar, joints, and immunity after 60? There is a spice sitting in most kitchen cupboards right now that has been used medicinally for over 2,000 years. It is inexpensive, widely available, and almost completely overlooked by modern health conversations. But a growing body of research is beginning to examine whether it genuinely supports some of the most common health concerns adults over 60 face every single day: blood sugar regulation, joint inflammation, digestive health, and immune function. Today, we are going to look honestly at what the evidence actually says about cloves. Not what is exaggerated online, what the research actually suggests, and where it still has a long way to go. Welcome to Healthy Aging Research. My name is Emily Hart, and this channel is built around one commitment: giving adults over 55 clear, honest, evidence-informed guidance so you can make better decisions about your health as you get older. We do not chase trends here. We do not sensationalize. And we are always going to tell you when something needs a conversation with your doctor rather than a YouTube video. Today's topic sits in that careful middle ground. Cloves are not a cure for anything, but dismissing them entirely would also mean ignoring a meaningful body of research. So let us walk through what is actually known, what remains uncertain, and what practical steps are worth considering, always alongside, never instead of, proper medical care. Before we move on, I want to ask you for a quick favor. 99% of viewers are still watching without subscribing. If you're enjoying this and finding it useful, take a second to subscribe. We're aiming to reach 1,000 subscribers by the end of this month, and your support truly helps. What makes cloves scientifically interesting? Before we look at specific health areas, it helps to understand why researchers are paying attention to cloves at all. The primary active compound in cloves is called eugenol. It makes up between 80 and 90% of clove bud oil and has been studied extensively for its anti-inflammatory, antibacterial, and antioxidant properties. Eugenol is not a new discovery. It has been used in dentistry for decades as a natural analgesic and antibacterial agent. What is newer is the research examining whether its effects extend meaningfully to other systems in the body. Cloves also contain notable levels of manganese. A single teaspoon provides roughly 30% of the recommended daily intake, along with vitamin K, vitamin C, and dietary fiber. For older adults, manganese is particularly relevant because it plays a direct role in bone metabolism and cartilage formation. These are not trivial nutrients, and getting them from whole food sources rather than supplements is generally preferable. What this means practically is that cloves are not simply a flavoring agent. They're a genuinely nutrient-dense spice with bioactive compounds that interact with real physiological processes. The question is not whether they have any effect. The question is how significant that effect is and for whom. Blood sugar and metabolic health, a genuinely relevant connection for adults over 60 managing blood sugar, whether that means a formal type 2 diabetes diagnosis, a pre-diabetic reading, or simply a concern about metabolic health. The research on cloves is worth understanding carefully. So Several studies have examined the polyphenolic compounds in cloves and their effect on blood glucose regulation. The findings suggest that these compounds may help moderate blood sugar levels both before and after meals, and that regular consumption could support insulin sensitivity over time. One study found meaningful reductions in fasting glucose among participants who consumed polyphenolic clove extract consistently. This is promising. But it is also early-stage research, and it does not mean cloves replace medication or medical monitoring. If you are currently managing blood sugar with prescribed medication, adding cloves regularly to your diet is something to discuss with your doctor first. The interaction between eugenol and certain diabetes medications is not yet fully understood, and your doctor needs to know about any consistent dietary change that could affect your readings. What is practical here and safe for most people is soaking 2 cloves overnight in a glass of water and drinking it first thing in the morning. This is a low-concentration, gentle way to incorporate the compound regularly without overwhelming your system. But again, if you are on medication, have that conversation first with your doctor. Joint inflammation and the anti-inflammatory evidence chronic low-grade inflammation is one of the most significant drivers of health decline after 60. It underlies arthritis, cardiovascular disease, cognitive decline, and a range of other conditions that become more common with age. This is why eugenol's anti-inflammatory properties are particularly relevant for older adults. Research has confirmed that eugenol inhibits certain inflammatory pathways in the body, specifically by reducing the activity of enzymes involved in the inflammatory response. For someone like David, age 68, who wakes up with stiff knees every morning and finds the first 30 minutes of the day the hardest, that mechanism matters. It does not mean cloves will eliminate arthritis, but consistent, low-level anti-inflammatory support from dietary sources is something rheumatologists increasingly recognize as meaningful alongside prescribed treatment. A practical approach here is warm clove-infused oil massage. Heat 2 tablespoons of olive oil, add 5 crushed cloves, allow it to infuse gently for a few minutes, strain it, and use it to massage stiff joints. The warmth helps the eugenol absorb into the tissue more effectively. Many people find this genuinely soothing for morning stiffness. If you are already on anti-inflammatory medication or have been advised by your doctor about your joint condition, mention this to them before adding regular clove use. It is a simple conversation that protects you. Digestive health. One of the most consistent benefits this is perhaps the area where the evidence for cloves is most consistent and least contested. Cloves stimulate saliva production and gastric secretion, which supports the breakdown of food more efficiently. They have well-documented carminative properties, meaning they help reduce gas, bloating, and the discomfort of indigestion. For older adults, this matters more than it might sound. Digestive efficiency naturally slows with age. Stomach acid production decreases. Nutrient absorption becomes less reliable. Anything that gently supports that process has real value. The simplest method is clove tea, 1 to 3 whole cloves boiled in a cup of water for 5 minutes, drunk warm after your main meal. This is gentle, inexpensive, and has no meaningful risk for most people. If you have a history of stomach ulcers or gastric sensitivity, check with your doctor before making this a daily habit, as concentrated clove preparations can occasionally irritate an already sensitive stomach lining. Oral health, where the evidence is strongest. If there is one area where the clinical evidence for cloves is genuinely robust, it is oral health. Eugenol has been used in professional dentistry for well over a century. It is a core ingredient in many dental cements, temporary fillings, and analgesic preparations. This is not alternative medicine. It is mainstream dental practice. For older adults dealing with gum sensitivity, mild toothache, or persistent bad breath, cloves offer a well-supported natural option alongside regular dental care. Placing a single whole clove in the mouth and sucking on it gently releases the oils directly where they are needed. Gargling with warm clove tea can reduce bacterial load in the mouth and soothe inflamed gum tissue. This does not replace your dentist. If you are experiencing persistent tooth pain or significant gum disease that needs professional assessment, but as a complementary daily habit, the evidence here is solid. Immune and respiratory support. Promising but measured cloves are rich in antioxidants, compounds that neutralize free radicals and reduce the oxidative stress that accumulates with age. Oxidative stress is one of the primary mechanisms behind immune decline in older adults, which is why antioxidant-rich foods consistently appear in research on healthy aging. During cold and flu season especially, clove steam inhalation is a practical, low-risk option worth knowing about. Add 3 to 4 crushed cloves to a bowl of steaming water, cover your head with a towel, and breathe the steam deeply for 5 to 10 minutes. The eugenol in the steam has mild antiseptic properties and can help ease congestion and soothe irritated airways. This is supportive, not curative. If you develop a respiratory infection that persists beyond a few days, worsens, or is accompanied by fever, that is a conversation for your doctor, not a home remedy. Important safety considerations. Please do not skip this before we recap. This section matters enormously for older adults specifically. 2 to 3 cloves per day is a sensible upper limit for most people. More than that can irritate the stomach lining and cause real discomfort. If you are taking blood-thinning medication, warfarin, aspirin therapy, or similar, speak to your doctor before adding cloves regularly to your diet. Eugenol has mild anticoagulant properties that can compound the effect of those medications in ways that are not always predictable. If you are on diabetes medication, discuss clove water or regular clove consumption with your doctor before starting. The blood sugar effects, while modest, are real, and they need to be factored into your monitoring. If you have a history of gastric ulcers, liver conditions, or are currently on multiple medications, a quick conversation with your GP before adding any new regular dietary supplement is simply good practice. Cloves are food. but in consistent medicinal quantities, they behave more like a supplement, and your doctor deserves to know what you are taking. A clear and honest recap. Cloves contain genuinely bioactive compounds, particularly eugenol, that have meaningful anti-inflammatory, antibacterial, antioxidant, and blood sugar moderating properties supported by research. For older adults, the most relevant and evidence-supported benefits are digestive comfort, oral health, joint inflammation support, and modest blood sugar regulation. The evidence is promising in several areas and well-established in others, particularly oral health. It is early stage in a few areas, particularly immunity and metabolic health, and more human trials are needed before strong conclusions can be drawn. Use sensibly 2 cloves a day in tea, warm water, or food. Cloves are a safe, inexpensive, and genuinely useful addition to a healthy lifestyle for most adults over 60. They work best as part of a broader approach to healthy aging, not as a standalone solution. Before you go, 3 things before you leave today. First, if anything in this video resonated with a health concern you are currently managing, please bring it up with your doctor or pharmacist at your next appointment. Show them this video if it helps start that conversation. A provider who knows your full health history is always your most important resource. Second, if this channel gives you something useful, subscribing means you will not miss what is coming next. Every video here is designed specifically for adults over 55, with honesty and without exaggeration. Our goal is to reach 1,000 subscribers. So if you find this video useful, please hit the subscribe button. And third, we want to hear from you. Have you ever used cloves for health reasons? Did anything in today's video surprise you or raise a question you would like us to explore further? Leave a comment below. Your questions shape what we cover next. Take good care of yourself. We will see you in the next one.